Imagine a filtration system that works round the clock, cleaning and detoxifying. Now imagine it malfunctioning. What happens? Suddenly, the once smoothly running system is thrown into chaos. The clean, purified output is replaced by a murky, toxic mess. And the whole system, it's teetering on the edge of breakdown. This isn't just a hypothetical scenario, it's a reality for many. It's the reality of a kidney condition known as glomerulonephritis. That, my friends, is a glimpse into the world of glomerulonephritis. So, what is this glomerulonephritis we speak of? Well, let's break it down. The term glomerulonephritis refers to a group of kidney conditions characterized by inflammation of the tiny filters in your kidneys, known as glomeruli. These little powerhouses are responsible for filtering excess fluid, electrolytes, and waste from your bloodstream and converting them into urine. Now, when these glomeruli become inflamed, their filtering capacity is compromised. Think of it like this. Imagine a coffee filter that's become swollen and clogged. It won't work as efficiently, right? That's what happens with glomerulonephritis. The inflammation hinders the kidney's ability to properly filter waste and fluids. Consequently, harmful substances can build up in your body, leading to a host of health problems. So while it may be a bit of a tongue twister to say, glomerulonephritis is a serious condition that requires our attention. Indeed, glomerulonephritis is much more than a mouthful of syllables. Now that we know what it is, what causes glomerulonephritis? The answer isn't as straightforward as you might think. Glomerulonephritis is often the result of a complex interplay of factors, rather than a single cause. Let's start with infections. Certain infections, like strep throat or skin infections caused by bacteria, can trigger glomerulonephritis. This is because the body's immune response to these infections can sometimes cause inflammation in the glomeruli, the tiny filtering units in your kidneys. Next, we have autoimmune diseases. These are conditions where the body's immune system mistakenly attacks its own cells. In the case of glomerulonephritis, this misguided attack can target the glomeruli, leading to inflammation and damage. Systemic lupus erythematosus, or lupus for short, is one example of an autoimmune disease that can cause glomerulonephritis. Now, onto medications. Some drugs, including non-steroidal anti-inflammatory drugs or NSAIDs and certain antibiotics, can also lead to glomerulonephritis. These medications can cause inflammation in the glomeruli, especially when used for long periods or in high doses. But what about the unknown? Yes, there are cases of glomerulonephritis where the cause remains a mystery. These are called idiopathic cases, which simply means we don't know why they happen. It's also important to note that certain factors can increase your risk of developing glomerulonephritis. These include having a family history of kidney disease, being of certain ethnic backgrounds with higher prevalence rates, or having certain other medical conditions like diabetes or high blood pressure. So, while it's a complex condition with multiple potential causes, understanding these factors can help us better prevent and manage glomerulonephritis. Remember, knowledge is power, especially when it comes to our health. As you can see, glomerulonephritis is a condition that can be triggered by a variety of factors. And, while the causes of glomerulonephritis can be complex and multifaceted, they're an important part of the puzzle in understanding this disease. But how would one know if they have glomerulonephritis? What are the signs and symptoms? This is where the mystery unfolds as we delve into the telltale signs of this condition. The symptoms of glomerulonephritis can sometimes be subtle, creeping up on you like a shadow in the night. One of the first signs that something might be amiss is the appearance of foamy urine. You might notice bubbles or a frothy texture that doesn't quickly dissipate after flushing, a sign that your kidneys are leaking protein into your urine. Next, you might start to experience edema, which is just a fancy medical term for swelling. This swelling is often most noticeable in the face, especially around the eyes and in the hands and feet. Imagine waking up and feeling like your skin is stretched too tight, your rings are suddenly too small, or your shoes are pinching. This could be edema at work. High blood pressure is another common symptom of glomerulonephritis. You may not feel any different, but a routine check could reveal that your blood pressure is higher than normal. This happens because the kidneys play a crucial role in regulating blood pressure. And when they're not working properly, blood pressure can rise. Other symptoms might include fatigue, loss of appetite, and sometimes even a change in skin color to a yellowish hue. These symptoms might seem unrelated, but together, they paint a picture of a body struggling to cope with the disruption caused by glomerulonephritis. Now, it's important to remember that each person is unique, and not everyone will experience all these symptoms. Some people may have only 1 or 2 symptoms, while others may have many. The severity of symptoms can also vary from mild to severe. Sometimes glomerulonephritis may not cause any symptoms at all, and it's only detected during routine medical checkups. Recognizing these symptoms early can make a world of difference in managing this condition. So pay close attention to your body, and don't hesitate to seek medical advice if you notice any of these symptoms. Your health is in your hands, after all. So how do healthcare professionals diagnose glomerulonephritis? That's a question that deserves our attention. It's a multi-step process where doctors leverage various tests to pinpoint the condition accurately. First off, we have urine tests. These tests play a pivotal role in diagnosing glomerulonephritis. They help identify red and white blood cells and high levels of protein in the urine, all of which are telltale signs of the condition. Next up, blood tests come into play. These tests measure the levels of waste products, such as creatinine and urea, to determine the kidney's filtering capability. If these levels are higher than normal, it's a strong indicator of potential kidney disease, including glomerulonephritis. But that's not all. Imaging tests like ultrasounds or CT scans provide a detailed view of the kidneys and can reveal abnormalities such as changes in size or structure that may point to glomerulonephritis. And finally, in some cases, a kidney biopsy might be necessary. This procedure involves the removal of a small sample of kidney tissue for laboratory analysis. It's the most definitive way to diagnose glomerulonephritis, as it allows doctors to examine the tissue under a microscope and identify inflammation or scarring. So there you have it. From urine tests to biopsies, the journey to diagnosing glomerulonephritis is a comprehensive one. With these tools and tests, healthcare professionals can accurately diagnose glomerulonephritis. Diagnosis is only the first step. What about treatment? This question leads us to the critical phase of managing glomerulonephritis. The treatment strategy for glomerulonephritis is largely dependent on the type and severity of the condition, the underlying cause, and the patient's overall health. The ultimate goal, however, remains the same: to protect the kidneys from further damage. Medications are often the first line of treatment. These may include drugs to control high blood pressure, a common side effect of glomerulonephritis, or medications to reduce the body's immune response, particularly if the condition is driven by an autoimmune reaction. In addition to medications, dietary changes can also play a pivotal role in managing this condition. A dietitian might recommend a low-sodium, low-protein diet to reduce the kidney's workload. Limiting fluid intake, on the other hand, can help control swelling and high blood pressure. But what if glomerulonephritis has progressed to a more severe stage and the kidneys are no longer able to function adequately? In such cases, dialysis may be necessary. This procedure artificially filters waste and excess fluid from the blood, essentially performing the role of the kidneys. In the most extreme cases, when the damage to the kidneys is irreversible, a kidney transplant may be the best option. This involves replacing the damaged kidney with a healthy one, usually from a donor. It's important to remember that every patient's journey with glomerulonephritis is unique. Thus, the treatment plan should be tailored to cater to the individual's needs and circumstances. Regular follow-ups with the healthcare team are crucial to monitor progress and adjust the treatment as needed. While glomerulonephritis can be a challenging condition to manage, effective treatments are available. The key is to approach the condition with a spirit of resilience and optimism, and to work closely with your healthcare team to create a treatment plan that works for you. And remember, with the right treatment and care, you can lead a normal, healthy life. Let's wrap up what we've learned about glomerulonephritis. It's a condition where our body's own immune response can inadvertently damage the glomeruli, the tiny kidney units responsible for blood filtration. This can be triggered by various factors, including infections, autoimmune diseases, or even unknown causes. The symptoms can be as subtle as a slight puffiness around your eyes, or as alarming as pink or cola-colored urine due to blood leakage. To confirm a diagnosis, healthcare professionals may rely on a combination of urine tests, blood tests, and sometimes a kidney biopsy. Once diagnosed, the treatment plan can range from managing symptoms and slowing the progression of the disease to aggressive interventions like immunosuppressants or even kidney transplants in severe cases. It's crucial to remember that early detection and appropriate treatment can make all the difference in managing glomerulonephritis. And that's a wrap on glomerulonephritis, a complex condition with a simple goal: to remind us of the importance of our kidneys' filtration system.